Hi, everyone. I'm Leanne West, and I'm the president of the International Children's Advisory Network. And I want to welcome you today to Ask the Experts, where sometimes the experts are clinicians and sometimes the experts are our youth members.
What we could do is go ahead and maybe think of an icebreaker. And for today, let's look ahead to what we would like to focus on for the iCAN Summit. So if there's a session topic that you're really thinking about that would be a wonderful addition to what we're planning, which we've just begun to start, you could maybe share your idea, because we'd love to hear from you as the young experts that bring so much wonderful richness and content to all of our event planning. So as you're thinking about things, just throw out an idea, and let's go ahead and kick off with Meg. Meg, would you like to introduce yourself and say something that you would like to see at the iCAN Summit?
Hi, my name's Megan. I'm 11 years old. I really like being an iCAN because no matter what we're doing, I always see that young people are getting together, and I think that's really important.
I love that too. That's my favorite part of the summit, is coming together and seeing everybody from all over the world and being able to share our passion for helping kids, other kids like yourselves, and kids who maybe don't have a voice, and being able to share our expertise to make it better. So that's a really awesome thought, and I love that we can do that again for the summit. Rhiannon, do you want to go next?
Sure. So I'm sorry, my dog is under the desk. My name is Rhiannon. I am 18. I absolutely love, as Megan said, like iCAN and just what it does and what it stands for. And I think it's a great opportunity for all of us to get together. I think during the summit, I would definitely be interested in discussing more on how we can improve the communication between patients and doctors, so that patients feel more comfortable and safe in their environment. So I think that's really important. And yeah.
Oh, that is so needed and necessary too, and having those good communication skills and really knowing how to talk to kids. I know that there's some pediatricians, not Dr. Chang. He's great at talking to kids, which is why he's here today. But there's some that may not feel as comfortable or may not know exactly what to say outside of, just a diagnosis or the treatment plan. So we can certainly help with that. And that might be a great project that we bring to our professionals group to help you lead, because as I was sharing earlier, Rhiannon is now our new young professional, adult professionals chair. So we are very excited to have her and
I'm
have
excited.
knowledge and expertise available.
Oh, I'm very excited. Very, very excited.
I'm so excited to have you. It just makes me smile ear to ear. So thank you. So Valeria, would you like to go next? Oh, I think you might be muted on your end. There you go.
Hi everyone, I'm Valeria. I'm 17. I'm from Ostuni in Italy, and I like to follow this project for everything I can do, or everyone I can help with my voice or my work.
Thank you. Oh, I'm so glad you're on here today. This is wonderful. And thank you for joining us all the way from Italy. That is so far from where we are here in Michigan. And I just love that you could connect and bring your expertise and experiences to this conversation today. It's so great. And as a side note, Valeria and I have been working quite a bit on different projects, and it has been a lot of fun to be able to connect frequently and to be able to make sure that her voice is heard and that everybody from all over Italy is represented. So thank you for all that good work. All right, let's go to Reese. Reese, would you like to introduce yourself and say something you're looking forward to or would like to see at the iCAN Summit?
Yeah, of course. Hi, my name is Reese. I go to Michigan State. I'm 20 years old. I'm also Amy's daughter, which is kind of if you couldn't tell by the last names. um, Something I'm looking forward to iCAN. I kind of have two different ideas, so hopefully that's okay. But if we could do like a give back to a hospital project like we did at Barcelona, we made little bracelets and then we were able to give that to all the inpatients that were there. I would love to do something like that. It doesn't quite have to be bracelets, but if there's a way to give like a tangible object to all the inpatients, I think that'd be a super great idea. And then also if there was a like a meeting about life after iCAN or like how to stay involved post high school graduation for those that still want to be a part of it. I think that might be a really great idea as well. So thank you. So nice to meet everyone.
I love those ideas, Reese. And full disclosure, I did not know what she was going to say. So it's nice to hear from her. Reese is in East Lansing right now, and I'm at her home. So it is fun to always connect with her on a Saturday when I might not get to see her normally.
Yeah. She doesn't
and-
prep me before these things.
No. And Reese, I'm wanting to introduce you to Rhiannon because that group that you're referring to is our young adult professionals, which is really nice because Rhiannon's going to be leading that. And it's interesting for the gift bag project too, for the bracelets. Begonia's online today, and so maybe she can talk a little bit about what they do and how that project worked because I think that was a really fun project. I remember attending that when I was in Barcelona and how much fun it was and how rewarding it was to make the bracelets and then to be able to help purchase them to give back to Kids Barcelona. It was a really neat thing, and it was, I think, one of the only times we did a project like that. If I'm right, Begonia, I don't remember doing that at any other summit. But it was really a neat thing. And so hopefully, fingers crossed, we are all in person this year and we'll be able to come together and share hugs and to be able to see one another close up and maybe do something like that. Begonia, did you want to jump in and share anything about that?
Yeah, thank you, Amy. The initiative that you mentioned about the bracelet, it's an initiative of a group of parents from our hospitals. All of them are parents of a kid with an oncology disease, and they do handmade these bracelets with plenty of volunteers across the whole country, not only in our region. And with the money that we obtain because are no donations to the hospital, we perform basic and clinical research projects in pediatric oncology. And I think that it's a very unique initiative. This started probably 7 or 8 years ago, that in the floor that we have in the main building in the hospital where the oncology patients are, they are for weeks or even months in the hospital, and they started to have fun creating these bracelets. And at any point they said, okay, why no? We cannot improve research, helping in the process to obtain donations for research. And this is the story behind, and the name of the bracelet, that it's Candela, that it's the name of the young patient that started the initiative in our hospital.
I love that. And I still have mine. Mine was pink and it had a little circle holding the two pieces together that tie around my wrist. And I love it. So that was a really nice thing to be able to take away. And a good reminder as you wear it of the importance of research and why we do everything we do through all of our young people's groups to ensure that there's a spotlight there, that the attention is being paid for kids. So I love that. So maybe we can talk about that and get some ideas going for the upcoming summit in July. I want to go back to Maya. Maya, did you want to introduce yourself and say what you're looking forward to about the iCAN Summit?
Yeah, sure. I'm Maya. Sorry, I'm a little sick. I'm Maya. I'm in 5th grade, and I'm really looking forward to getting to connect with people all over the world in the iCAN Summit. I think it's really cool how people come from like all over to do the iCAN Summit.
I love that too. I can't say that enough because that does make us a better community when we can see all of our friends from all over the world and know that we're all in this together. So at iCAN, we often say, I can make a difference. And truthfully, all of you are making such a big difference. It's so important, and we're so glad that we can join together. So, Karen, I wanted to come over to you too. I saw that you popped on. Karen's one of our adult friends. Did you want to jump on and just say who you are and talk a little bit about what you're looking forward for the iCAN Summit?
Well, let's see if I can attend, actually. That would be awesome. I'm actually traveling to the World Expo in Dubai in a couple of weeks in the UAE. So I'll be thinking about iCAN in some way when I'm there. So my name's Karen Feinberg. I'm calling in from Boston. I'm from Minneapolis, Minnesota, yay Midwest. And I am founder and principal of a mission-driven innovation and strategy consultancy. Part of my academic background and interests, as that is within the School of Education at Harvard in a program called Risk and Prevention, which has a different name now. And part of my stakeholders that I serve have been youth through and through my life's work. And I discovered this through MCRT, and really happy to have discovered this incredible community that's doing incredible work. And I love Spain, by the way.
I know, it's beautiful, isn't it? Oh my,
Yeah.
Begonia's lucky her weather is so nice there all the time. So I love it. And also having the ocean right there. It's just
I
gorgeous.
saw a bullfight. That was really hard to see when I was there.
Yeah.
But anyway, glad to be here.
I'm so glad you're here too, Karen. Thank you for joining with us. All right, so our wonderful speakers today, Dr. Chang is hosting our event. So I'd like to turn it over to him to introduce himself, and then to bring Lisa, who is our special guest star today. Lisa's here from the MRCT, and hopefully you all had a chance to see the card that we shared that talks a little bit about what Lisa's career has been like and what her passions are and why she does the work that she does through the MRCT and helps to support iCAN. So Dr. Chang, I'm going to turn it over to you and let you run this. Our topic today is just to have a conversation about COVID and where we are now. So whatever we want to discuss, we can hopefully tackle that.
Thank you, Amy, and welcome everyone to an hour dedicated to iCAN and all of you. And I just want to add that I think it would be great to have a session on the iCAN members and what they would tell their doctor if they weren't so embarrassed or if they wish they could. I think we had a session like that at one point, and it was so entertaining and so educational at the same time. So you sort of could just use that opportunity to tell we doctors what we should really hear from you. And since no names are mentioned, you can just go crazy, So I'd like to introduce Lisa, who is from, as we heard, from MRCT, and maybe she can introduce herself and how we can have the benefit of her being here today. Lisa?
Hi, thank you so much. So good morning and good afternoon to everyone, depending on where you are. And I really appreciate this opportunity from Amy and Claire and others at iCAN to be a part of this Ask the Experts discussion today. Honestly, you're all the experts. I'm here as a fly on the wall. That's how I see myself. But I've been working at the MRCT Center for about 2.5 years. And for those of you who aren't too familiar, we're like a very small research and policy center. And we work on things related to the conduct of clinical trials. So we don't run clinical trials, but we work on things like what should we do with the data after a trial, or how can we incorporate making material accessible to everyone through using like health literacy. So not speaking in words that only the dictionary understands, things like that. The project that I've been working on, and this is how I met Amy and Claire and Meg and Begonia and now all of you on this call, we've been working on a project for about 2.5 years that really looks at how clinical trials for pediatrics are run. And some of you have the experience directly with clinical trials. Maybe you were in one, maybe you know someone who was in one, maybe you know a little bit about research. For all of the young people in iCAN, you probably know more than I do because you're the experts. Most of the adults on the call have a real interest in kids and what's important to them. And so we started doing this project where we were talking to people from all over the planet about what makes it so hard to run clinical trials for kids. Why is it even more difficult than for adults? And what we started to see, no matter what we were talking about, no matter what the topic, we always ended up, without fail, talking about how the perspective and the voice of young people needs to be brought into the conversation. And I got to know Amy because I think Amy and Leanne are in the project work group, which is a group of amazing people, all different backgrounds, all different corners of the planet. But so Amy's worked really closely on this young people's, this clinical trials sort of deep dive. And so because of that realization that every conversation ended up at the same place, which is, why is this so hard? You know, young people have a ton to say. We have so much to learn. How are all of us on the planet who work with kids in medical settings and clinical research settings, how come we're not all doing this? Begonia has carved out kind of this amazing space through her work. And I've learned so much from Begonia, from Amy, from iCAN. But really, that's kind of the work that feeds my soul. And so we've done a lot of really what I think is important work to that end. So I can get more into that. But, you know, for me, being here this morning is a real honor and a real gift to hear all of your thoughts. So I'll just stop there and we'll take it from there. But I give it back to Dr. Chang, who's running the show here.
Well, maybe we can ask our young people here what they think clinical research is and how they should be, how clinical research should be in the future. I think Lisa would be the perfect person to comment on your suggestions or your idea what research is and what it should be. And have you been involved in the research project? Maybe a few of you have already been involved in a research project.
Dr. Chang, just to clarify, you're asking the young people on the call, correct? For their
Yes.
thoughts. Yeah. Good.
No, you would be the perfect person to respond to their
comment.
No,
my audio zipped out for a minute, so I didn't know if I was on the hot seat. So.
No. Well, you're young enough. Maybe we could ask you to get started. What you think research is, and especially for our young guests here, and what it should be. Maybe or with a future forward-thinking research.
Well, like I'd ask the young people on the call, tell us something that you know about clinical research, whether because you've learned it through your work and involvement with iCAN, or because of some experience that you've had or that you've seen someone have. And it doesn't have to be personal, just, you know, tell us something that you know, and we'll get this conversation going. Because I think everyone knows a lot. And we all probably know things that are a little bit different from each other. So throw it out there. We're a small, friendly group this morning.
I was just going to say, I can jump in real quick and just help a little bit with this. As you guys know, I'm a mom. So one of my kiddos is on here, and I say kiddo, she's 20. And my other one was unable to join in today. But as a mom, we've participated in a lot of things. As a family, we've done clinical research. We've also done clinical research individually. And the work might not seem as exciting. Sometimes clinical research can be something very simple. It could just be having your data quietly being shared to someone else to help collect it for a group. Sometimes clinical research can be receiving new treatments or testing out a new device if you have that. So just kind of reframing that. I know sometimes when we hear the words clinical research, it can be hard to think back in your own health history to think, well, was I in anything? But once we start talking about it, then all of a sudden you remember what you participated in, maybe what you shared, maybe even it's just something with iCAN that you helped to make it better and more friendly for other kids. That's still you helping to share your voice within clinical research. Even if you weren't a direct participant, you were still an advisor. So all those roles are really important. So does anybody remember doing anything like that or have a story that they want to share? And this group is a judgment-free group. There are no wrong answers. You can say anything you would like. We just are here to collect ideas and to share stories so that we can have a really good conversation and help each other learn something by the end of the day. Oh, it looks like Maya does. Okay, Maya, did you want to unmute and just maybe share a little bit?
I think
Yeah.
Megan has a comment too. Yeah.
Every year there's one where, sorry, my voice is hoarse. Every year someone comes to our house and does a research study. I think it's on hearing and how hearing kids and deaf kids have differences. I really don't remember what it was about. And my mom works at, she's a researcher, so I've done a couple that are random and I don't really remember what they were about.
So fantastic for you to share that. Thank you. And I think what you said is often really true. Lots of times people know they were in research and don't exactly maybe remember because they were super young, or maybe might not have like all the details clear in their mind, and that people might have ideas about that experience, like what you know versus what you're not sure you know with research. But that's awesome that you could share that with us. Thank you.
I think Megan has a question
yeah.
or a comment. Megan?
I was just going to say that I've been a part of a clinical trial, but I was very young, so I didn't know anything about it. I'm pretty much just finding out about it now, and I don't know where any of the information went. They really didn't say anything about it after it happened. I think it was just a one-time thing, so I don't even remember what it was about. I think it had something to do with kidney function, but I didn't really know much about clinical trials before we started talking about it in iCAN, and now that I know about it, even though I wasn't able to find out about my own clinical trials until now, I feel the need to stand up for other people, other children that want to know what's going on with clinical trials, whether they should participate, and maybe one day I can participate again in a clinical trial and know where it goes and what it does and be more educated than I was when I was younger.
You bring up so many great points, Meg, and a lot of the things that you were talking about are things that I think, and I know kind of everyone on this call agrees are really important to make sure young people understand what's actually being asked of them. If a doctor or a research doctor says, do you want to be in a trial or a clinical trial? It's so important, like you point out. Obviously, as a little kid, you're not going to know necessarily or remember. The adult that is caring for you is going to make those choices. But as young, smart people, you want to understand, well, what's actually being asked of me, and not just what's being asked of me, but like, if I say yes, what does it mean? If I say no, what does it mean? If I say yes and change my mind, what does it mean? So you bring up a lot of really important points. And I think some of those things are things that iCAN has done a lot of work around educating young people for, and some of you have had input into that. So there's research, and then there's all the ways that research is supported and made better by what young people have to say. Just thought I'd throw that in there.
Yeah, I'd definitely like to add on to that. I think we kind of mentioned it before about the importance of communication between the patient and the doctor. I think going towards one of the other things that you brought up, I think it's hard for patients because a lot of us are younger. And when we start off that way, it's like we don't think to advocate for ourselves, and we have our parents, doing all the talking and stuff like that. But I think when we have a doctor who is not communicating on our level, and even the parent is stressed out with situations and understanding what's going on, it can be hard to create that connection between the two. And as you said, Megan, I think it's really important that you know what you're participating in, you know what's happening, you know what's going on, you feel comfortable with the situation. And if you don't feel comfortable, you feel as though you have the room to say something. So I think clinical trials should really be focused on ensuring that it's geared towards helping patients. And when we're helping patients, it should be that we're communicating with them and not just dictating sort of a research project. We're not just conducting it and using these people as test subjects, but rather communicating with them and saying, we want to improve on your life. Will you help us do that? And how can we work together to do that? And do you understand what that means? And what can I work on and what can you work on?
How did all that wisdom get jammed into 18 years of a brain? I just don't get it. Amazing.
Can I just make a comment about someone on the side of research? Done a lot of clinical research projects, probably hundreds. And I'm always amazed how welcome and how accommodating parents are for research projects. The number of times that I think a parent said, no, we're good. We don't think we want to participate. I think I can remember, I think the number of times in 30 some years, I can count on one hand with fingers left over. It's really rare that a parent would say, well, no, we're good. We choose not to participate. And some of the research projects are quite, I wouldn't say risky, but quite involved. And I'm just, the love of a parent for their own child, but also for other children is just immense. And when I look back on my career as a clinical researcher, that's one thing I'll always say to people. It's just amazing how parents are. And now that I'm a parent of a child with a medical condition, I can see that it's not straightforward to be involved in a study, especially if it deviates a little bit from routine care. But it's just amazing how caring and loving parents are, not just for their own children, obviously, but for other children with the same situation.
So one thing that I did talk with my mom about was that for her, it was really difficult because there was already a risk, where we were starting off at. And just for a little background, I had sickle cell and lupus. And so those two diseases together weren't really known of, at the time, we only knew one other person in Texas, I think. And even her situation was really bad. And for sickle cell, you kind of rely on the immune system to do some of the work because your body is not producing enough oxygen or sending enough oxygen throughout the body. And then for lupus, it's, the immune system is attacking the body, so you really need that oxygen. And so I think at the time it was like, okay, well, do we get involved in a research study that has a lot of risk and the benefits are kind of there, but we're not 100% sure and it's never been done before, but we don't want to not do it because if we don't, then, you're kind of in a worse off position. So I think it's also kind of hard for both the parents and the patient because you have to look at where you are now, what would happen if you didn't do it, and what happens if you do it, And I think that also creates a barrier in communication because you're scared and you don't know what questions to ask, and you're not always educated about the things that are going on. And when we are scared, we kind of forget to look at all of the other aspects that are, having to play. And I think that's where educating the patients and the parents thoroughly on the things that are going on and communicating with them and walking them through it is where the researcher has a responsibility at.
What great points. So critical.
Lisa, let me ask you a question as a clinical researcher, and I think our young friends here would like to know too. roughly what age, and I know every child is different in terms of level of maturity, but at what age roughly do you think a child should be involved in giving the permission or getting to understand their research project?
So that's a great question. And I think it's one that people struggle with a lot. So I just want to be clear first before I answer. I'm not involved in clinical research per se. I'm involved in kind of the background noise of research, like how can trials be run, particularly for kids, in a way that makes more sense for the young people and their families. But to your question, I think it's hard to say there's a number of an age where a kid, and I say kid, my kids are 28 and 7 and whatever, I call them kids. So I hope people aren't offended by that word. I think young people have a lot to say from a very young age. And I think also very often when young people are unwell, they have this wisdom that's sort of beyond their years. So I think that when young people are old enough to communicate verbally, there's the opportunity to kind of capture their thoughts. And I mean, you know, everyone here was or is a kid. Several of the older people on the call have kids. I think we all, if you're working with kids, you have to have kind of this flexibility and patience and not really have an agenda that's tied to a timetable. So I think when we're working with young people and we want to understand what's going on, we all have to kind of take a deep breath and take a step back and give ourselves and the families time and space to feel comfortable and to feel comfortable sharing their thoughts and their opinions. And I think very young kids can do that. You know, so I don't want to put a number on it, and I'm not waffling, but I think if someone can engage in a back and forth verbal communication with a young person, then they've got something to say and share. How's that for a non-answer? Amy, what do you think? You do this all the time, Begonia. You know, you guys work with kids.
Yeah, I wanted to jump in and just go back to the chat for a second to make sure everybody's voice is heard. Valeria had mentioned that she really feels strongly that it's important to think also not just about research for pediatric conditions, but specifically focusing on rare disease. And I think that piece is so important. And we hear that a lot. There, as Valeria had typed in, there's thousands of rare, tiny little population diseases that need support. And, you know, we don't want to forget that. I do want to tell you, Valeria, for the summit, our overall theme is going to be focused on rare disease so that we can make sure that that is a point that is very clearly communicated of the importance of making that happen as best as we can, and not forgetting those tiny little populations because they are just as important as all needs. And we want to definitely pull that out. So that was a good point. And then Lisa, to your point about, you know, just even having discussions with doctors, I think this is a really great one. Maya had written in that when she was really young, she couldn't talk to her doctor. She felt very afraid to do so, and it was just difficult for her. So we posed to the group, you know, what are some ideas? And Valeria chimed in with thinking about a doctor like a friend and talking to them in that sense. But I think you can also flip the equation and say a doctor could also talk to a young person, you know, instead of a clinical manner, much more friendly, and to share the information in a way that meets that young person's needs and really helps to create that conversation. And that's really what we want to do. That's what I want to do through, you know, the efforts that we put forth through iCAN, and why we feel so strongly about making sure language is appropriate, that, you know, kids are consulted and given the ability to review materials before they're sent out, and really ensuring that everything we do is in a way that makes sense for a young person. So I'm going to flip this over to Begonia because I see her hands raised, and I want to learn from her too.
Yeah.
You, Amy and Lisa. In fact, I want to add something on top of your comments, because I think that this is a right of the patients, for every patient, even if, you know, they are very young. We need, the professionals, we need to have the right capabilities to communicate, but they need to be informed And this is at least how we do in our hospital. In any medical procedure, in any medical trial, we try to explain with the right words and the right resources. This is very important because sometimes it's better, a short video or an infographics than, plenty of explanations or text format documents. But I think that we need to recognize the rights of the children to receive this information, and also they can help us, Amy said, in the process to have the right materials and resources to inform the patients, because there is still, even in the field of research, that we obviously are receiving a lot of resources and materials from the sponsors. Sometimes they are not very patient friendly, and this is a big and important barrier to ensure that the patient knows what is going on in this medical study, and obviously to have a decision making process with the agreement also of the minor, even if the minor has not the legal age to consent. In Spain, it's 12 years old. In other European countries, it's a different age, probably older and younger. We have this big issue in Europe, which makes sometimes very complicated the life to the sponsors. But I think that considering this in every country, and this is at the end a partnership between the sponsors, the academic institutions, and the pediatric hospitals, we can do better. And I think that there is a lot of room of improvement, because it's hard, at least specifically the consent process to participate in a clinical trial. And for the medical procedure, sometimes also the same, because we need to inform them. And in some cases, if the procedure is invasive, anticipate what it's going to happen.
So important. So important. Thank you.
So I'm just going to add that I think it's not acceptable for a child and a parent to be hearing about a research project for the first time when they're in the hospital under care, and also from a stranger. They need to have this continuity, ideally before they get admitted, and also from their own doctor, because I think that's much better and better accepted for the child and the parent. And I see oftentimes parents and children get admitted to the hospital, and they have literally sometimes 10 different research teams approach them for a research project. And I think that just, very, very inconsiderate. And I think we should do a better job on the clinical research side to just make things a little bit more friendly for the children and the families.
See, Reese's hand is up.
Hi, yeah, I just wanted to put my 2 cents in for this too. Like my mom talked about, we were involved in a ton of clinical trials growing up, and felt like there was always something that we were allowed to be a part of, and we were thrown into, which was fun, because before even joining iCAN, I really knew the clinical research side of medicine pretty well already. But yeah, I think as I get older, I wish there was more communication about the results of the clinical trials I'm a part of, because I feel like I put in all my time and I really bring in a lot of effort and bring my ideas to the table. And then I don't get a lot of what comes as a result of the study and what I put all my work towards. And I think that's a huge part of that's missing from everything. And honestly, my communication with my researchers has been pretty good during the actual clinical trial. It's just that aftermath piece that I just think is lacking a ton. But yeah, I don't know. That'd probably be my only thing if I could fix something or tweak something about being a part of clinical research, is even if it's like an infographic or something too, like just all like the fast facts from everything that happened from the clinical trial. I think that would be super helpful, and then encourage me to be a part of more as well.
What a great and super important point to bring up. And listening to all of you talk, I'm really heartened, because iCAN has been, and Begonia, and the youth that they work with have been working with us at MRCT on some kind of educational materials for young people. And a lot of the topics that you've all highlighted is important are some of the things that we also have thought are important for young people in terms of getting information. But also there's the flip side, because sometimes I think doctors and researchers can forget that a young person is a person and a researcher is a person. And we all, I think it's on the adults to remember that we can talk to people like people. And so we adjust how we speak because of someone's age, right? That's a part of normal everyday courtesy. And I think sometimes, somehow, for some reason, that can get forgotten in a medical setting or a research setting. And so part of this big picture of work is to help people who work with young people to know just those things that you've all been pointing out. Communication, give us information that makes sense, that we can understand, help us feel not nervous to talk, talk to us like we're people. Like, all of this seems like common sense to us on the call, right? But how to convey that beyond this circle is part of the work to be done. So you guys I think are spot on in everything that you've brought up.
And I think, Lisa, we should really emphasize that. And Amy, maybe we can actually have some action items, because a lot of times the clinical research team will come in with the child in the room and almost like ignore that child. It's just direct eye contact and discussion with the parent. And I think by having, I like the suggestion about having some educational tools for the children about the research will then, I think, force an engagement with the child. And I think maybe that's a great action item that we should, have clinical research do in general, because I'm guilty of not doing that. So now I feel bad. But we should really, really have educational materials, even a one-page summary for the child in the research would be a wonderful idea. And we should almost just insist on that for clinical researchers in the future.
So great, yeah. So many hands up.
I'll go.
Karen was first, so I want to go kind of in order.
Thank you. So I had a question that Claire, it came from Claire's comment, and then something that Dr. Chang mentioned brought up another idea for what you were just saying, Dr. Chang. So the question I have in terms of following up and letting the participants, youth and families involved with clinical research, and how do you keep them in the loop after? I wonder if someone can speak to how much of that is for the public domain and has to be kept sort of private, if you will. I don't know if it's for IP purposes or, you know what I mean? How much can the researchers share over time with the participants? That's the first question. And then through the Southwest Pediatric Medical Innovation community that I'm getting to know through, all of these things that I've been engaged with this past year, there was a innovation that was presented, very cool, for kids who have a hard time, and even the families and the doctors, giving shots to kids. And it was an innovation using a VR platform. So while they're getting the shot, the kids are also like engaged with this VR platform and learning about what's happening. And it just made me think when Dr. Chang mentioned that what he had just mentioned, that a VR platform could be an interesting tool for what you had just mentioned. I don't know what you think about that, Dr. Chang, and you probably already, are engaged with stuff like that, but that seemed so natural. So question, and then that idea.
Yeah, we have several ongoing VR, AR projects, and I'm happy to say we actually have some parents involved and just for a pilot. So I think the boundary between research and children's and families' experience is starting to blur, which is good. I think we need to involve the parents and children much more. And I'm involved in that sort of a philosophy that clinical research shouldn't be clinical researchers in white lab coats coming out and talking to patients' families. It just should be very, very well sort of streamlined into the care so that it seems sort of invisible, so, but we're working on that.
Cool. Holistic.
All right. Just because we have about 15 minutes left, I want to go to Begonia and Rhiannon. If you guys want to share a little bit about what your questions were, and then I want to reserve the last few minutes because our session today, as it happens often, we start with one topic and we kind of veer to something else that we're really passionate about. But I do want to give about 5 minutes at the end of the day just to answer any questions we can about the impact of COVID and where we are right now. So if you have any worries or concerns or thoughts about it, we can certainly address that as best as we can. So let's start with Rhiannon and then we'll go to Begonia. Or Begonia first. Begonia's already unmuted, so let's
Problem, no problem. Was only last comment about, I think that was Reese that mentioned about the outcomes of the clinical trials. And I think that it's important that you know that in Europe, the European Clinical Trials Regulation is going to be fully implemented the 31st of January. And it means that one of the last things that we were in the process to implement are going to be the live summaries. And here we have done a lot of work because are going to be mandatory for all the clinical trials. And specifically in pediatrics, we have help to explain that even the regulation said that the life summaries need to be addressed to the public. If the patients involved are children or young people, they deserve to receive the information in a friendly format, not only in text, probably in videos, infographics, or in another way. And this is again something that connects with the right of the children and with the transparency of research, because patients are volunteer in a clinical study, and they deserve to receive at the end of the study the results. And I think that also it's another important area where the young people can help a lot to co-create these live summaries and to validate that really this information is accessible for them, because usually it's very scientific, and even if you have been patient in this clinical study, sometimes you don't understand the final result of this trial.
Okay, Rhiannon, did you want to go ahead?
No, I'm good. Thank you.
Okay. Begonia, that was a great point, and I really appreciate that, because I think having that lay summary follow-up and understanding, what that is for patients, it's so needed. And I love that you are working hard to do that. It's really important. I see Lisa's hands up. Lisa, you don't have to put your hand up. You're our special guest speaker today.
Of course I do. I'm one of the tiles on the screen. I just wanted to follow up on what Begonia said. I love that, because it really if I take 2 steps back, almost all of this conversation has had to do with communication, with sharing of information. And that all boils down to kind of respect from one human to another human, and remembering how important that is, and how important it is to be, we all wear multiple hats. We can be parent, kid, researcher, research participant, doctor, whatever we are. But we're, at the end of the day, we're all human beings. And if we can learn how to better respect each other, respect the rights of each and every one of us by speaking and communicating what's important, what's necessary as human beings, and then human beings who happen to also be participating in a trial or working in a trial, whatever, it's all of our, is the adults' responsibility to make sure this gets better traction. So all the things everyone has talked about, to me, all is part of this same kind of ball of respect and making trials work better, and what are the parts all of us can play. And I just have loved listening to this discussion. So I wanted to hop on that one point from Begonia and then spin off a little bit, but thank you.
I agree. This has been just so wonderful. Thank you. So switching gears a little bit, and I'm giving us a few more extra minutes for it, just because I know that this is a topic that our youth members requested. They always have questions about COVID and where we are now. I do also know that we may not have the answers, and that's okay. But we are all in this together and really thinking about the effects and trying to make it a little bit better for each of us. So if you have any questions and you want to ask, anything about COVID, feel free to do so. And if we don't have the answer, we will certainly get back, but I think this is a good time to switch to that topic. Okay, I can jump in, just kind of help get it started, but one question I've been asked a lot is, are we going to be traveling in person? And that question is a good question. It varies by need and by area. So, some companies can travel again. Some companies still aren't allowed to travel. Some people might have traveled already on holiday, and then maybe over the Christmas holidays, and then are back in their homes. It's hard to predict for the summer, but our plans still are to be in person, and we're still planning on being in Lyon, France. So we're not changing gears just yet because there's no need. It's hard to look ahead that far in the future to July. But our intent is to continue to work towards the goal of seeing everybody in person.
Yeah, I think by summer, we should be pretty much at the very tail end of Omicron. Expect Omicron to be really active in the next 2 to 4 weeks. So hopefully by summer we'll be hopefully at the very tail end of Omicron, and hopefully not in the middle of another variant. That's what we're all afraid of. So we just have to keep an open mind and pivot whenever we need to. But I think it is not predictable whether or not another variant will follow. And I think as long as large areas in the world that are not vaccinated, we're always going to be facing that risk. So it's a very unpredictable year, but Omicron will run out probably in the next 2 to 4 weeks.
And I just wanted to point out, Valeria brought up a really good question on how long do you think we'll have to still carry masks with us? And I know I've wondered about that as well. I'd kind of stopped taking mine as much, and now I wear it everywhere again, even in line at a drive-through or something. So do you have any idea on that, Lisa or Dr. Chang at all?
I defer to a real doctor. So
well, I happen to have a global health background, so I'm familiar with these topics. I think it'll be best to have it with you the rest of the year, because especially if you're planning on going to different places, every area is going to have its own sort of viral demographics, and you need to be, I think if there's the slightest doubt, you should just put it on. I think most people are so used to it by now. But I think the one point that's really important right now is that all along the cloth and the surgical mask have not been adequate. And yet the public probably thought it was enough. And some people even wear it as a fashion statement, which I think is really not taking this pandemic seriously enough. And I think even my kids have had the KN95s all along. So I think the virus, if anything, will get more transmissible. And it's not just droplets coming from other people, but the viral particles, I don't know if people know in general, but the viral particles actually hang in the air like a scent from a perfume or a cologne. It's just kind of there. And it's not necessarily it doesn't necessarily have gravity and from people in general. It's just kind of a fume of virus in closed indoor areas. So you kind of have to be really respectful that no one has to be even in the room for you to get it. If someone's been there just a few minutes ago and left the room, you can still get it. And I think that's perhaps a misconception that the CDC didn't help to dispel, is that you can just get it from being indoors. Outdoors will be very hard, but indoors you can just get it even if there's no one else in the room. So I personally think at least through summer, you should carry a mask with you, and maybe even throughout the rest of the year. Sorry about the bad news. And I think one question I get asked is, how long do these things last? If you look at the engineering part of the KN or the N95 masks, they can last a few weeks, but I think given what's going on, I probably wouldn't use it for more than a week or two. even though structurally they can last 3 to 4 weeks. It was really not, as you know, these masks are originally designed for industry. They're not really designed for pandemics. So I think we have to respect the fact that, if you wear it every single day, you can wear out that mask pretty quickly from your own secretions. And it's probably about 50 to 100 hours is the lifetime of a mask. I certainly wouldn't wash it. And some people ask me about that. Can they just wash their disposable mask? And I can't guarantee the integrity of the mask after you wash it and dry it.
Why, Dr. Chang?
I think the material itself is disrupted when you do that, especially high temperature drying, which, I mean, literally people are taking it in a washer and drying. It's like a cloth mask, but I don't think the material is meant to sustain that kind of a disruption.
Is there time for me to mention something very briefly about an experience with a home test or no?
Let's table that, Karen, just so we
You got it.
Meg first. Meg, did you want to go ahead and share what you were thinking?
I was just going to ask, since I know that viruses mutates and they start getting weaker because they don't really want to kill their host, they just want to be able to feed off of it. So I was wondering how many more variants of COVID there would probably be before it becomes so mutated that it doesn't get us sick anymore.
Great question. I love the insight. You should consider being a biologist at least.
Thank you.
I think without scaring all of us, what's intimidating is that viruses oftentimes mutate to a weaker form so that it kind of coexists with the host and doesn't really kill the host, as you mentioned. But somehow this virus has some sort of intelligence because it learns to mutate to a more transmissible form. And at the same time, it can still kill some of the hosts, not many, but some. So I think, and again, as I said earlier, until we vaccinate the entire world, we're always going to be susceptible to variants. And we're just hoping the variants will become weaker and be more amongst us rather than the other way around, because it could easily be more transmissible and kill the host. And we just don't know. The variants are, as you said, there to survive longer, but it doesn't necessarily need to spare, many of the hosts. It just wants to survive. I think those of you who are interested in COVID and all of its information, there's been a lot of confusion amongst experts, but the one expert I would highly recommend, and I'll put it in the chat, is an epidemiologist that I've known about since my global health days, and his name is Michael Osterholm. I think I've mentioned it. And he has a weekly podcast. And that's pretty much the only thing I really listen to. Everyone else has been wrong consistently and confusing, including the CDC. So if you really want to just dedicate an hour to, I think, really valuable and accurate information, I think Michael Osterholm and his podcast, he heads up the Minnesota's Center for Infectious Disease and Prevention or something like that. He's very well regarded. He's often not on TV. I don't know if that's by choice or just by people not appreciating what a genius he is in this area. He correctly, believe it or not, predicted back in March 2020 that there will be 800,000 plus deaths in the United States. I don't know how he came up with that. So that I have a lot of respect for that. Someone who is that accurate, that far ahead of time. And he's the one that said Omicron will run its course in the next 2 to 4 weeks. So be especially careful with your masking and not. I see lots of people letting their guard down right now. And that's probably why Omicron has spread so quickly. I have some close friends who got a little bit careless, start going into indoor activities, noticing that no one else is wearing a mask. So they took off their mask, which is not a good idea. And then they got infected. So this is a time not to be sort of letting your guard down, because there are potential long-term consequences of COVID that we don't know about yet. So the worst thing would be to letting your guard down and say, okay, I'm just going to have a little cold, even if I got infected. We don't know what the long-term consequences are, especially for younger people. So please, please, please be careful. Extra careful, not less careful.
I just want to jump on here real quick and point out Maya shared in the chat that she and her family are right now experiencing a COVID diagnosis. So We are hoping you all come through this speedily and with ease, and you're back on your feet quickly. And maybe we can just give one quick little update, Dr. Chang, if you don't mind. If you could just share the Omicron versus the Delta variant, because I think there's better news in that situation overall for many, many people.
Yeah, the better news is that Omicron seems to affect less people more seriously, especially in people who are triply vaccinated or fully vaccinated. We don't know what the data looks like for younger children, especially less than 5 years of age. So that's the part that we're still waiting for. We're hoping that it's the same with the really young children, is that they're not as affected. But unfortunately, children's hospitals are filling up with patients who have this diagnosis. So I think if you're not vaccinated and you're spreading Omicron around, unfortunately, the youngest kids may be the victims to this infection even more than adults. So that's why we have to be really extra careful.
All right. Well, is there any last little bits? We are at the top of the hour. So I wanted to say thank you to everyone for being on this call today and for sharing your expertise and your wisdom, and your questions are just so wonderful. Meg, did you have one last comment that you wanted to share?
Yeah, I was just wondering, since we were talking about people unmasking when other people do, so I was wondering if, since although the viruses mutate so that they get less severe, then the numbers can still rise because other people unmask when other people do. So I was wondering if that habit of having people unmask because they think it's less severe could actually reverse the process and have another variant come that's more severe instead of mutating to become less severe. Would it sort of change the course of the virus?
Absolutely. That's why we have to be not fatigued by this and not think that we're in the clear, because the viruses are going strong with its variations, and it's not going to stop. So, and it could easily be more transmissible and be more deadly at the same time. So that's what we're all afraid of. And by the way, break through our vaccinations. So this is not a time to, I'm really disappointed and confused why so many people are unmasking, especially indoors. So I think, those of us who think differently and maybe know a little bit more may just want to remain masked at all times. Well, it's been great to see all of you. And I know in this period, it's so difficult not to have human-to-human connections, but really applaud what all of you are doing. And thank you, Lisa, for coming. And this is the best time for all of us to have more caring, more love for each other, and not take any future human-to-human interactions for granted anymore. This is such a tough time for humankind, and really tests our character, I think. So please take care of each other. Please take care of healthcare workers. They are really truly burned out, and a lot of them are leaving. So it's a really sad time for me to see colleagues thinking about leaving the health field, and yet so many young people wanting to come in. So there's that hope that hopefully that we will have for the future, is all of the young people here devoting their lives to healthcare will be really inspiring for all of us. Bye, everyone.
Bye.
Thank you so
See you
much.
next month.
Bye.